With regard to the joints of the lower limb and injuries to those joints, let's say a word about the hip joint. Now, when we talked about the shoulder joint, we talked about how commonly the shoulder joint dislocates, and we said the reason that that's true is because of the shape of the socket. In the case of the shoulder joint, we said that the glenoid fossa was actually very small and shallow, so it was quite unstable. In contrast to that, in the hip joint, it's again a ball and socket joint, but this time the socket is really quite robust. It's a very deep and a very strong socket, and that's why hip dislocations are really quite uncommon unless the trauma is so severe as to cause fracture of the hip, of the acetabulum. So fracture dislocations may occur with severe hip trauma, automobile accidents being a common cause, but simple dislocations of the hip of the adult are fairly uncommon. However, what is common, particularly in older adults, particularly older women, postmenopausal women, are hip fractures. Hip fractures. Now, even though they're called hip fractures, that's not precisely correct. What would be more correct is to call them femoral neck fractures, because that's what's actually fracturing, is the femoral neck, this region right here. Remember that the weight is being transferred. As we stand, weight is transferred from the vertebral column to the pelvis, from the pelvis to the femur, to the femoral head, and then down the shaft of the femur. So when one is standing, there's a tremendous amount of weight being transferred from the pelvis to the femoral head and then across the femoral neck to get to the femoral shaft. So the femoral neck is under a great deal of stress. Torque, rotational force being applied to the femoral neck. And therefore, the femoral neck is built in such a way as to be very strong to support that weight. But as particularly women get older and osteoporosis becomes a problem, and there's a loss of calcium and a loss of matrix and a loss of bone strength, fractures tend to occur, and of course they will tend to occur in the major weight-bearing bones, which of course includes the femoral neck. So we can get femoral neck fractures fairly commonly in these patients. And a very important issue relating to femoral neck fracture is an issue very similar to what we previously discussed with regard to scaphoid fractures in the wrist, and that is a blood supply issue. When we look at this illustration, we see that almost the entire blood supply to the head of the femur is getting to the femur by way of branches of this artery called the medial femoral circumflex artery, a branch of the deep femoral, and those branches get to the femoral head by traveling up along the femoral neck. And so therefore, when the femoral neck gets fractured, there's a pretty good risk of separating the femoral head from its blood supply. And so similar to what we talked about in the wrist, the issue of avascular necrosis becomes very real, and there's the risk of avascular necrosis of the head of the femur secondary to femoral neck fractures.